everyone, I'm Dr. Issa, your OBGYN on call. Today we'll explore one of our most requested topics, UTI or urinary tract infection. I'll walk you through the signs to watch out for, the common causes, treatment options, and some simple ways to help prevent it. But before we begin the discussion, consider subscribing to our channel and ticking the notification bell. Our goal is to provide you with reliable, medically backed knowledge on sexual wellness, pleasure, and love toys. Your support on this channel helps us reach more people who might benefit from this knowledge. Let's first begin with the fundamentals and explore the urinary tract. On the right side of your screen, you will see a diagram of the urinary tract system, which includes the following parts. The first thing that you have to know are the kidneys. These are small bean-shaped organs that are located toward the back of your body, just above your hips. The purpose of this organ is to filter water and other waste products from your blood, and this waste will now turn into your urine. Next are the ureters. So these are thin tubes that connect your kidney to your bladder. Towards the bottom of the diagram, you will see a balloon-like organ. That is the bladder. Its main job is to store your urine until you're ready to urinate. And finally, you have the urethra. This tube transports your urine from the bladder to the outside of the body. The urinary tract acts as a body's filter for blood, creating urine as a waste byproduct. So let's now talk about the urinary tract infection, commonly known as UTI. UTI is a general term for an infection that affects the urinary system, which includes the urethra, the bladder, and even the kidneys. It may come in three types. So the first is urethritis, which only affects the urethra. Next is cystitis, and this type occurs when the infection from the urethra spreads to the bladder. And we have pyelonephritis. This happens when the infection further spreads upwards to your kidneys. UTIs are quite common according to the National Institute of Diabetes and Digestive and Kidney Diseases. Bladder infections, also known as acute cystitis, is the most common occurring type. Another key fact about UTIs is that females or people assigned female at birth are more likely to have a UTI compared to males. According to Medical News Today, around 40 to 60% of females have developed a urinary tract infection at least once in their lives, and around 10% experience one annually. You might be wondering why females are more at risk, so here is a diagram showing the difference between a male and a female urethra. As you can see, the female urethra is much shorter, only measuring around 3 to 5 centimeters. In comparison, the male urethra is around 15 to 20 centimeters long. This shorter length in females makes it easier for bacteria to travel to the bladder, increasing the risk for a UTI. However, for our male viewers, please know that while the chances are a bit lower, it doesn't mean that you can't get a UTI. They're still possible, so follow the prevention tips, and if you notice any symptoms, please consult your doctor immediately. To help you detect a UTI early, here are some signs and symptoms to watch out for. Symptoms vary depending on the location where the infection is located. If the infection is located in the lower part of your urinary tract, such as the urethra or the bladder, you may experience the following: a burning sensation while urinating, increased urgency and frequency even if only a small amount of urine is released, changes in urine color, it can appear cloudy, dark like cola, or even slightly red due to blood, a strong unusual odor in your urine, fatigue, pelvic pain in females, or even rectal pain in males. If the infection has reached your kidneys, these are the signs to watch out for: fever, chills, nausea, vomiting, restlessness, pain and tenderness on the back and the upper sides. Now, for those who are watching this and currently experiencing upper tract symptoms, kindly stop what you're doing and please see a doctor immediately. Upper tract UTIs or acute pyelonephritis could be life-threatening because if the bacteria from your kidneys enters the bloodstream, then it could lead to urosepsis. Don't wait it out, get treatment before it gets worse. So what's actually causing these UTIs? Depending on where the infection is located, there are a few different culprits. For bladder infections, these are often caused by a bacteria called E. coli or Escherichia coli, which is commonly found in the gastrointestinal tract. For urethral infections, this can happen when bacteria from the anus spreads to the urethra. Urethral infections can also result from sexually transmitted infections like chlamydia, gonorrhea, herpes, and even mycoplasma. There are also several risk factors for UTI, many of which primarily affects females. For instance, using diaphragms or spermicidal agents for birth control can increase UTI risk. Menopause is another factor as it leads to a decline in estrogen, which also impacts urinary health. As I've mentioned earlier, female anatomy plays a role, so a shorter urethra will make it easier for bacteria to reach the bladder, and this will put females at a higher risk compared to males. Frequent sexual activity also raises the chances for bacteria to enter the urethra. There are also risk factors that impact people of all ages and genders, including having prior medical conditions that affect the urinary tract, blockages from a kidney stone or an enlarged prostate, using a catheter, having a weakened immune system, or if you just had medical procedures done on your urinary tract. Let's talk about diagnosis and treatment. Your healthcare provider may start with a medical history and physical examination and can request for a urinalysis. They can also decide if further tests are needed, like a urine culture, blood tests, or imaging studies such as an ultrasound or an X-ray of the urinary tract. In some cases, minor urinary tract infections can clear up on their own. Your doctor might even suggest waiting it out if your symptoms are incredibly mild. Since antibiotics are the main treatment, then your doctor should be guiding you as to which antibiotics would be the best for you. Using them too often or self-treatment can make future infections harder to treat. While many people suggest the use of cranberry juice or cranberry supplements as a natural treatment to UTI, there is no solid evidence of their effectiveness. Studies about them exist, but the data is limited or inconclusive. Not only that, but drinking store-bought cranberry juice with sugar can actually exacerbate the symptoms as it can encourage the growth of bacteria. Staying hydrated with water is typically enough to help flush out the infection. Now, if you're experiencing severe symptoms like unbearable pain while peeing, fever, or seeing blood in your urine, then see a doctor right away. And once you're diagnosed with a UTI or a urinary tract infection, then most doctors will prescribe an antibiotic for symptom relief. And for pain, you can be prescribed with an acetaminophen or paracetamol or NSAIDs or non-steroidal anti-inflammatory drugs. Be sure to complete your entire course of antibiotics even if your symptoms improve. Stopping early might leave some bacteria behind, which can lead to recurring infections. UTIs can be prevented by doing simple lifestyle changes. Stay hydrated. Drinking enough water daily helps flush out bacteria from your urinary tract, making infections less likely. Consider increasing your intake of water if you are more physically active or if you live in a warmer climate like here in the Philippines. Avoid delaying trips to the bathroom when you need to go. Holding in your urine allows the bacteria to multiply in your bladder, increasing your risk of developing an infection. Practice good genital hygiene. Keep up with daily washing of your genitals with clean water and change your underwear daily. For people with vulvas, wiping from front to back is recommended to avoid the spread of bacteria from the anus to your urethra. When engaging in vaginal sex, it's better to use a water-based unflavored lubricant as these are gentler to the body. I highly recommend Lovette's water-based unflavored lubricant. It mimics the feel of natural lubricant, giving you that much-needed glide during intercourse. Wash your genitals both before and after sex to minimize bacterial exposure. Another tip is to pee after sex. It potentially helps flush out any bacteria that is located in your urethral opening after intercourse. Avoid having sex if you or your partner is experiencing any UTI symptoms. This can prevent further irritation and spread of bacteria. Also, if you're having recurrent UTIs due to the birth control that you're using, like diaphragms, then you may switch to other birth control options like pills, injectables, implants, or the IUD. Keep your sex toys fully sanitized by cleaning them with an antibacterial soap or a dedicated sex toy cleaner. These don't retain bacteria if you clean them properly, so it reduces bacterial exposure to your urethra. And one last tip for our female viewers. Many feminine hygiene and period products claim to keep you feeling fresh down there with added scents. However, be cautious with heavily scented products, as this can irritate your vulva and urethra, which can increase your risk for infection. Stick to unscented products for better comfort and health, like these organic pads and tampons from Harmony. And that wraps up our guide for today. But before I say goodbye, I just want to remind you that this is not a substitute for a direct consultation with your healthcare provider. If you're experiencing any UTI symptoms, whether it's just 1 or 2 signs, or you just feel that something is a bit off, don't hesitate to contact your healthcare provider. They can help you explore the best options to relieve discomfort and manage pain. Also, don't forget to like this video and subscribe to our channel to stay updated. Your support means a lot to us. I'm thrilled to bring you more helpful guides in our next episode. Until then, take care of yourselves. Bye!